Well, we've been learning over the past few weeks how the Consumer's Choice Award is a vote of confidence in the business that proudly displays the seal. Medical professionals also strive to reach that same level of consumer satisfaction, and one such company that has earned this award is Rinkov Eyecare Centers. And it's important to take care of our eyes because they get a lot of use and abuse. And here's a quick question for you. How many hours a week do we spend on an electronic device? You know, a computer, a smartphone, a tablet? Well, it amounts to 37 hours a week. No wonder our eyes need some TLC. Joining me now from Rinkov Eyecare Centers is Mark Rinkov. Welcome, Mark. It's nice to see you.
Welcome. Thank you.
You sent me that statistic, and I have to tell you, I was pretty shocked at that statistic.
It's huge.
And I'm sure it's gone up year after year consistently.
It is. It is.
So when people start using these devices, as opposed to the written word that we've been used to, what are the differences in how it affects our eyes, Mark?
Big difference is blue light is emitted by these screens. Blue light is the low wavelength, the hot wavelength of light. It's from 380 to 500 nanometers. And that is emitted, and it causes burning, it causes irritation, causes strain, it can interfere with the sleep pattern, circadian rhythm.
It really can do all those
Again,
things?
Yeah.
Is there a way that, as consumers of all these electronic devices, that we should know what to do or try to limit the amount that we use it? Because, face it, we're all in front of a computer screen
Absolutely,
all the time.
yeah. Recently they've come out with some lenses and glasses that block some of the harmful blue light. There's good blue and bad blue, and this blocks some of the bad blue. So net effect is less fatigue on the eye and more comfort at the end of the day.
So we're talking more about stress and nothing more serious than that, though, stress on the eye.
Correct.
Okay. Another problem people are dealing with, especially in these winter months, is dry eye.
Right.
I mean, even more so in winter months. Does this happen more when folks age?
It does. Dry is sometimes metabolic. The glands just don't produce as much. Eyes get dry. And most patients don't even know they have dry eye. Mm-hmm. And what happens is the tears evaporate. And when they evaporate, they start to blink more to see better. They start to itch a little bit, start to feel a little burning. And there are certainly ways to treat that disease, basically.
So those are signs of people that have dry eyes, so they may not know what's wrong, they just know their eyes are bugging them, and they should probably see a professional? Yeah,
oftentimes someone will come into me and with no symptoms of dry eye, but then I do some testing and find out they do have dry eye, and then when I do tell them that, they say, oh yeah, I've had this before, oh yeah, that's what's wrong. And you start to treat them, and they get better.
And can you give me examples of how you do treat this?
With medication, eye drops.
Mostly eye drops right into the eye. All right, another problem you see in your practice is helping folks with diabetes, and I didn't know that there was an eye relationship to this disease. So what can happen, Mark?
Well, diabetes is one of the leading causes of blindness. So if you have bad diabetes, you can get hemorrhaging in the back of the eye. You can get what's called exudates, which are deposits. And if they attack the macula, the central vision of the eye, which is where the rods and the cones and all the receptors are, you actually can go blind.
What can people who have diabetes do then to prevent it?
You have yearly checkups with an eye doctor, and we look inside the eye, take a very close look at called the retina, and assuming that that is okay, there are many diabetics that have no problems, but once they start to have what's called retinopathy, then there can be issues, and then we need to treat that accordingly.
So the sooner you find this out, though, the better for that person?
Yes, then we have them control their blood better, their diabetic medications better, we send them back to their physician or to an ophthalmologist.
And one more thing, macular degeneration. Now, this is something I know affects the older population.
Right.
And I'm hearing more and more about it. Is it becoming more common?
No, it's always been there. It's just better diagnostic testing.
And maybe it's because, too, that we're have a bigger
too.
population that's getting older.
Right.
Are there ways to curb it, or especially if you know it's in your family, what you can do to prevent it?
There are ways that you can help totally to try to prevent it, which is basically vitamins. There's vitamin therapy that has the special vitamins of zeaxanthin and lutein.
And I hear that, and I'm thinking, does this really work, and is it reputable?
It is reputable, and I think it does work. Jury's out 10 years from now. Typically, we try and start patients before there's a problem, and also if there's a family history of it, then certainly try to start them on that. It can't hurt anything.
It can't hurt anything. I guess that's the point. What have you got to lose, especially if it's in your family?
But once you have it, you can't reverse it.
Yeah, unfortunately, I do know that is true.
Right.
Doctor, it's nice to have you here. Thank you so much. Great advice.
Thank you. Thanks.